Well, good morning, everybody. It's so wonderful to see you here for our 5th Project Independence Aging in Place Conference. I have it from good word. The breakfast was actually delicious. So thank you, Harbor Links, for doing the amazing job that you do anytime we have something here. So, your presence here is really a reflection of the town and Project Independence and the dedicated staff behind everything that Project Independence has to offer our seniors in the town of North Hempstead. North Hempstead genuinely cares about each and every senior, and I'd say we spend every day trying to make sure that we're finding different ways to reach out, to connect, and I think the theme of today's expo, Operation Project Independence Connect, is so important because it's about trying to connect, making sure that we're connecting with you, that you're connecting with the services that you need. And it's aging in place, and I'd like to think we have a lot of years ahead of us of aging in place. We want to make sure that we do it right so that we're all here again and again and again hearing about all the latest things to help us do just that. The strength of Project Independence comes from our partnership with the Health and Human Service organizations, all our local senior groups, and our government agencies. I think the strongest part of Project Independence actually is the fact that every Project Independence group in a community has a Project Independence advisory group. So we're hearing directly from our seniors who are involved with Project Independence, what's going well, what's not going well. Because you can try, and just because you try doesn't mean it's going to be right. We need to hear if things need to go in a different direction. And by having the advisory groups, we hear just that. We hear what's on your mind, what you think we're doing that's good, and what you think needs to be done better. Because the minute you think everything is just fine, that's when you have to leave. Because it's never all just fine. We always have to be looking for what we can do better, how we can move forward. And that's the goal of all the people who are here working with Project Independence. So I want to especially thank the lady who introduced everything here, our Commissioner of Community Services, as well as Department of Services for the Aging, Kimberly Crigalante. Her terrific staff, who's here for us all the time. We have some very wonderful speakers today, and I know all the speakers are going to be wonderful. So I know that we have experts on these panels and should be great sources of information for all of you. I'd like to take this opportunity to thank our wonderful sponsors, Northwell Health System, Parker Jewish Institute, AgeWell. Let's hear it for them. They're major sponsors. AARP, Earworks, what'd you say? No, okay. Ronald Fatula, Esquire, Gerwin Family of Healthcare Services, and United Lifeline. And of course, all of the wonderful exhibitors who are here today, I encourage you to visit with them. They'll have great information and some pretty neat giveaways as well. So Project Independence has grown through the years, and while we still offer classic curriculum such as improving your balance and exercise classes, we now also include technology classes called, and I think aptly so, Technology for the Terrified. If you have kids and grandkids, they go onto computers, they have no problem, they're with the smartphones, and we're sitting there going, So we want to make sure that we are able to be in this new world of technology. It's not so new anymore, but it keeps changing, and it's important that we keep up with the changes. We want to make sure everyone who has a smartphone knows how to use it and can take advantage of all the different applications that are on it, because it really opens up a whole world. If you leave here today with any questions about Project Independence, or you'd like to take advantage of Project Independence services, please talk to our Project Independent representatives who are really all around the room and will be here all day. And you can always call 311, ask your question, and someone will get back to you. And visit our website, www.northhempsteadny.gov. If you're not a member of Project Independence, sign up. It's really tough. You call up 311 and you say, I want to be a member. It's as simple as that. So we're delighted that you're here. I want to again give a shout out to my colleagues in government, because without their support, we couldn't do any of the things that we do. Again, Councilman Veronica Lurvey, Councilwoman Lee Seaman, Councilman Peter Zuckerman, and our town clerk, I like to say the wonderful Wayne Wink, because they're here today. They want to see what they can do to continue supporting our seniors in the way that is so important and so vital. So thank you for being here. It was great to see you, and hope you have a wonderful day. Thank you.
I'd like to introduce again George Martinez, who's going to be moderating this panel, Medicare 2020 Updates and More. Mr. Martinez is the Deputy Commissioner at Nassau County Department of Human Services Office for the Aging. Welcome.
Good morning, thank you. Well, good morning, everyone. How you guys doing today? You have a chance to have some lunch? Thank you, yes. You have a lunch? You have a chance to get some food over there? Hi, Carol, how are you? We got some familiar faces here. Well, once again, good morning. Like I was saying, my name is George Martinez. I'm Deputy Commissioner in Nassau County Office for the Aging. Before we get to our very distinguished panel here, just a couple of things about Nassau County and the aging. Currently, there's about at least 350,000 people over the age of 60 in Nassau County. You are the fastest growing segment in this county. By 2030, and I'll say it again, by 2030, which is about 11 years from now, there's going to be more citizens over the age of 60 than under the age of 18. And just think about that for a while. Over the next decade, there's going to be a significant change in how this county looks, acts, works, and plays. We at the Office of the Aging, we currently run 14 centers in Nassau County. We have approximately 4 in the town of North Hempstead. And so far this year, on this year alone, we're on pace to serve over 600,000 meals to our seniors in Nassau County. This morning, we have a real interesting topic, Medicaid 220. Both of my parents are in their 80s, and this year, every time around this year, they get all nervous and get all crazy about Medicaid and the benefits. So we're hoping that today, with our panel, will be a chance to at least give them a chance to explain to you or to discuss with you what they know and what comes up. But more importantly, this is about you. And I'm going to ask the panelists to keep their comments focused and short to give you a chance to ask as many questions as possible. From my immediate left, all the way out, we have Barry Klicksberg. He's the Associate Program Coordinator, Nassau County Health Insurance Information Counseling and Assistance Program. Next to him, we have Danielle Izzo. She's the Associate Clinical Professor at St. John's University, College of Pharmacy and Health Sciences. At the very end, we have Sherry Glaser. She is the founder and owner of Metro Physical and Aquatic Therapy. So please give all of them a quick hand right now. And to start us off this morning, I'm going to ask Sherry to kick it off. Sherry?
Well, I'm so honored to be here to share my expertise on active aging. So because I'm a physical therapist, I need everyone to sit up straight. Right now, because we've been walking around, this is a great event, so everyone with beautiful posture. And what's interesting, if you listen to my presentation and focus and sit up straight, and if you want, you even can tap your feet, you're going to increase your memory. So does anyone here have issues with some memory once in a while? Right? We all do. So sit up straight, focus on what I'm saying, and tap your feet quietly. You will get so much neuroplasticity. Oh, do I need a mic? I never need a mic. I talk so loud. Hello? How do we do this? Hello? What do I do?
I'll trade.
Hello? This is better. Okay, so sit up straight and focus and tap your feet, and we'll get some brain fitness going while I'm talking. So I'm a physical therapist for 44 years, and I'm a senior. So I practice what I preach, and I'd love to share with you some trade secrets. And every one of you sitting here has wellness benefits by Medicare, and that's what I'm going to talk about this morning. There are 3 different categories which I'll cover. We're going to talk about exercise classes, nutrition classes that you're eligible for, and you even can get some gift cards if you exercise or even take a dance class. It's unbelievable what resources you have. And as I share the information, you'll see some phone numbers. But up here, I have some flyers that has the website, that has phone numbers. So if you're not sure which insurance type you have or what benefits you have, we have some great information for you. So what do I press here?
Talking to the wrong one.
Yeah, the up arrow.
You got it. Okay. So what we have here is Medicare Part A is hospitalization. I'm going to be talking about Medicare Part B, which provides supplemental benefits and wellness programs. Just curious, so I see who I'm talking to. How many of you exercise every day? Raise your hands high. Good for you. How many exercise 3 times a week? How many exercise 6 times a week? I love it. Now, I'm not going to judge who does not exercise. Come on, let's see. Okay, so after this presentation, you get free wellness benefits, so hopefully you'll take advantage of that. And I just have to throw one more thing in. If you exercise 170 minutes a week, you're going to increase your memory. We need this. Forget about cardiovascular, strength training, and balance. So I just want you really to reflect on these benefits and take advantage. So Medicare Part B, look at me with these glasses, the up arrow. Where's the up arrow? Which one is it? Which one? Oh, this one, the side arrow.
That's why I make the big one.
So the question is, are you covered? So some of you might recognize some of these insurance plans. This is a group of insurance companies that are represented by Trinity Health, which provides silver sneakers. So if you have any of these plans, you get unbelievable benefits. But if you don't get sad. You'll have other benefits in a minute. So what is silver sneakers? It's an exercise class that you need certification for. It's a free program for eligible seniors, and it's provided at so many locations throughout Long Island. My company, Metro Physical and Aquatic Therapy, we provide it in 15 locations, so you can look on the website or you can get the information here. But if it's not convenient, if you go on the website, there are so many different gyms or health clubs that have these programs. We're the only physical therapy practice that has it on site, and it's so wonderful. It works on balance, posture, it works on brain fitness. We incorporate Pilates, yoga. There are so many different kinds of classes. It's not for old people, it's for active seniors. And if you feel maybe you have to do it seated, you're welcome to, but it's really diverse. So if you go to a really creative program, you will always want to go. So let's see if we can do this. How do you think I press this video? Do I just press?
Yeah, I don't think the video's gonna work.
Okay, so everyone sit up, and while I'm talking, let's just do this. Okay, so the Silver Sneakers class we provide incorporates balls, bands, and you almost had a video, but next time. It is so exciting. And have any of you here almost fallen in the last year? Or fallen? We need to decrease your risk of falls. So the Silver Sneakers class really works on core, balance, and agility and strength. And some of us have osteoporosis. You need to get bone strength. So you see I'm an advocate of exercise. What's interesting, Trinity Health is the management company for Silver Sneakers, for all those insurance types that you saw before. You also get the opportunity to get other supplemental benefits. Nutrisystem, could you believe you get 50% off of these products? So if you have any issues with diabetes, weight loss, it's just another wonderful benefit I wanted to give you some information on. This is unbelievable. Could you believe Humana, which was one of the insurance types for Medicare Part B with Silver Sneakers, they pay you to exercise. So there's an insurance card. Here you go. Let's just say, here we go. You can go to the doctor and get a mammography. You can go to a dance class. You can go to a gym 8 times a month. They pay you. You can get up to $245 in a gift card. So I'm giving you an example with Humana, but like AgeWell has programs. All of these separate insurance types for Medicare Part B will give you great benefits. So right now you have till December 7th to get educated and to find out about your Medicare Part B programs. Ashley Fitness is another management company, kind of competing with Silver Sneakers, that also provides wonderful programs. So depending on your insurance type, it could be Elder Plan, Cigna, you can see the list. They provide something called Silver and Fit. Silver and Fit is like Silver Sneakers. In our company, we kind of do it the same. We're creative, but it gives you the opportunity to go to a gym and use the classes. Again, you need to look at the website to see where it's being given. In addition, they pay for something towards a gym membership, and also they're giving you a lot of fitness coaching as well as exercise rewards. There's something called Active and Fit. So even if you're not a senior and you might be disabled, they also offer those programs. So Ashley Fitness is another management company for other Part B plans. I think what's so wonderful is sometimes we all need to talk to someone. Ashley Fitness also provides fitness coaches. So let's say you don't even know where to start. I don't know if I'm ready for a class. They really provide services during the day. You can call and they can talk to you about your goals. They might give you a trainer depending on what location you pick. So you really have to look at the website to see where you live and the programs. So Active and Fit for disability, younger than 65, the following insurances are covering that. Every single insurance company does not always cover if you're under 65. So again, all the details are on the phone numbers and the website that I have here. Well, the good news now is Medicare with AARP as secondary has something called Renew Active, and that's run by Healthy Contributions. So we have another management company now for straight Medicare. And listen, they have to compete. You have Medicare, now you have wellness programs. So they have something really special. They have 24/7 access to a nurse. If you have any questions about diet, medication, they also have wellness coaching. And that's really important because I saw a couple of you don't exercise, you need to call that wellness coach. We also have access to fitness centers. Sometimes they'll pay you $33 for a gym, sometimes they'll give you a full membership. In my location, we made a deal with them. So you really want to call, see what's good. And you know what the best thing is? It's getting you out of your home. All of you are aging in place, it's amazing, but you need socialization. So isn't it amazing that Medicare finally got it? They are giving you so many programs. You're getting paid to take a dance class. Isn't that wild? So if you look at the last column, healthyourway.com, if you go online, there are recipes for cooking, there are cooking classes, like I mentioned, dance classes. And they also really are focusing on socialization. So we've kind of gone through the 3 different categories. You have Silver Sneakers with Activity Health, then you have Renew Active, and we also have Ashley Fitness. One of those is on your card. So you need to look at your secondary Part B card to see which one you are. So what's coming to Medicare in 2020? Unbelievable. Transportation to doctors, education on the website. We all read when we have a little free time. It is unbelievable the research that shows, it's another lecture I'll give another time. If you exercise, great things happen. Nutritional counseling, you are what you eat. Cooking classes, and even if you need some home improvements, I know some of the vendors there are doing modifications. If you're in the shower and you need grab bar, Medicare is paying for this now. If you have to widen your doors because you have a wheelchair, or if you want to put something in the shower just to make it safer. I was so happy to see with breathing problems, if someone has COPD, guess what? They come in to wash your carpets. So they really have so many benefits that we all need to explore what we have the opportunity. So, a little plug for me. I own Metro. The kids don't want to see me anymore. I used to work with the Yankees in the Open. I'm working with seniors. So I'm yours. I love what I do. And if any of you have any questions later, you let me know. Thank you.
Good morning. Thank you for having me here today. I'm happy to be with everybody. So I'm going to be speaking about Medicare Part D specifically. You're going to hear Barry in a little bit talk about kind of the umbrella of all the different parts of Medicare. But in terms of Part D, well, first a disclosure, I am not paid by or affiliated with any of the Part D plans or a pharmacy or a pharmaceutical company. It's a very common question I get. I'm a faculty member at St. John's University. I'm a pharmacist by trade. You might have met my pharmacy students that were over by the table that we have, so they're sitting right back in the side of the room. Wave hello to the pharmacy students. But we are available to help choose Part D plans. So what is Part D? Part D offers your drug coverage. So for seniors, the Part D is going to be the part of your Medicare that is you're going to give to the pharmacist. Now, it gets a little bit confusing, and by a little bit, I'm totally understating that. It's very confusing, because how do you know what Part D plan is good for you? You can see here that, you have Part A, you have Part B, and that's kind of, your global coverage. But Part D, there's 27 different plans that are available to you to pick. So how do you pick that? How do you know which one is right for you? There's a lot of, we share information, right? It's just people in general. Oh, what do you have? What do I have? What's good for your husband, your wife, your best friend might not be what's good for you. So there's your standalone Part Ds, but then there's also your Part D that could be married in a Medicare Advantage plan, which is, I think, something Barry's going to talk a little bit more about. So what do you need to know? You need to know if you're eligible. If you're above 65, you're eligible for Part D. Some of you in this room might be like, I have Part D, I don't really need to listen to this anymore. You need to continually be evaluating if your Part D plan is good for you. What was good for you in 2019 might not be good for you in 2020. So at the very least, you need to be looking at what your plan looks like for 2020. Because there's a couple of different parts that talk about the out-of-pocket costs for you. So you need to review the 2020 changes that are being sent to you. If you don't understand what those mean, you need to reach out to somebody that can help explain that to you. Pharmacists know a lot. So everyone, if you're taking medications, you probably have a pharmacist either at your local community pharmacy, maybe you know somebody that's a pharmacist. It's a good place to start, but it's hard for us in the community to keep track of everything. So you might want to reach out to, you probably met a lot of people here at this conference, someone that can help really explain all those differences to you. If you're very happy and you reviewed those changes, you don't need to do anything. You'll automatically be enrolled in that 2020 plan. So that means if you don't review your 2020 changes and you don't do anything, you will automatically be enrolled. Sometimes that's a good thing, sometimes that's not a good thing. You just want to at least be aware of what that's going to look like for 2020, because sometimes the plans change significantly. Or, even more commonly, something about you changed. Maybe you went on a new drug this year that now is not covered under your current plan, that is not being taken accounted for moving forward. So it's important to do those reviews. If you're eligible and you don't have a plan, you need to start looking at it from ground one. And that sometimes is the hardest part. So some of the dates that you need to know. We're in open enrollment, right? So open enrollment started October 15th and it closes December 7th, right? So you need to choose your plan by December 7th of this year. That plan goes into effect on January 1st, right? So those are the important dates that you need to know. So you're really at a perfect time being here at this conference and looking, forward towards some of the other events that we're having to help with choosing your Part D plans. So the donut hole, right? This is the one thing when everyone talks to me about Part D, they say, well, what about the donut hole? So there are really these 4 phases of Medicare Part D. You have your sort of deductible, your initial coverage. after your initial coverage, what we always used to call this donut hole, and it's kind of where a gap in coverage happens, that's really closed in 2020. So what we're not seeing is this high spike in all medications. It's kind of spread evenly over the second phase and the third phase. And then there's a part called the catastrophic gap. When you spend over a certain amount of money with Medicare Part D, your copays are now deeply discounted. So you're a high medication user, or at least it's costing on the higher side, where your copays and out-of-pocket costs are a little bit lower. Okay, so that was kind of like the easy looking slide, but this is what Part D will look like for you in those 4 phases. So in that initial deductible phase, not every plan has a deductible. Some do, some don't. If it doesn't have a deductible, does anyone know what a deductible is? Yes? Maybe someone's shaking their head no. A deductible is how much you have to pay at the pharmacy before your coverage kicks in. So some plans have those deductibles, some do not. If they do not, you're paying for it somewhere. It's just about how you want to spend your money. After that deductible, you're paying 25% of the drug cost, right? So it's no longer a $5 copay or a $10 copay. It's a percentage of what it costs. And then when you get into that catastrophic gap, you're paying 5%. So you can see that your out-of-pocket costs are a little bit lower. So how do you choose a plan? How do you pick something? You're probably getting a lot of phone calls, mail coming to you, advertising for different plans. It's hard to choose that way. Medicare has a plan finder. With that being said, it's difficult to navigate. It's challenging to navigate. There's a lot of great information. It's the only way I am able to help patients choose plans, but if you're not very computer savvy, it might be challenging. Again, not necessarily for me, but one of the things that myself and other faculty from St. John's University and pharmacy students are doing, we have 4 sessions that are set up kind of throughout the local area where we are making one-on-one appointments, where you can come and sit with myself as a pharmacist, pharmacy students, and we will take that plan finder and your personal list of medications, plug it in, and look at what is going to be the most cost-effective option for you. And I can tell you what's good for you might not be good for another family member. You'll be so surprised how you might be choosing different plans. But that plan finder helps guide us of what your drug costs are gonna look like for the whole year. So sometimes patients tell me, well, I'm gonna pick the one that has the lowest premium, but that doesn't mean that's gonna be the lowest overall cost. So I like to look at the overall cost and then work backwards and look to see, well, this is the overall cost. Is there a deductible? What's the monthly premium? Because really at the end of the day, it's what you're gonna be out of pocket for the course of the year. But people like to spend their money a little bit differently, so we have that conversation. There are other ways to get assistance. You can call Medicare, they can help you. You have a HICAP representative, and there are going to be these community sessions. So if you're interested in making one of those appointments, you can call 311. I didn't bring flyers here with me, but back in the vendor room, we have a couple of flyers so you can have those dates on hand for you. And I don't enroll somebody. I'm only guiding somebody to help to see what might be the best option for you. And then you would go ahead and enroll in that plan if you chose. The benefit of having a pharmacist do this type of review is that if there's a cost-saving opportunity, we will make those recommendations. As a pharmacist, I can't change a prescription for you. I'm not a prescriber. But if there's a medication for cholesterol that you're on that I see is, we call them tiers, right? Like a tier 1 is something that a drug plan wants to cover. A tier 3 is something it covers, but it's gonna cost you more. So if your cholesterol medication is a tier 3, I'll be able to make a recommendation to your prescriber to say, this tier 1 medication is covered. I think it would benefit your patient just as much. And I would work with your physician or your prescriber, maybe it's a physician assistant or a nurse practitioner, who would have to say yes or no. So I would look at if there's any changes clinically in your medications that could help save you money. Usually in any specific drug class, there's at least 2 or 3 other medications that might offer some cost savings. It's usually the time that we have a conversation about brand medication versus generic medication. Maybe you're taking a brand medication, but there's a generic available. You might be scared. You might say, I haven't heard great things about generics, so we'll have that conversation. Okay, so yes, there are a lot of people that can help you, and they are all wonderful. So if you're meeting with people outside of it being a pharmacist, you can bring your pharmacist at your local community pharmacy into the conversation to ask them, is there a way I could potentially save some money? So what do you need when you're choosing a plan? So I mentioned that I take that list of medications and I plug it into the plan finder. So you need to be bringing a list of your medications that include the name of the medication, the strength of the medication, and how often you take it. So if you take something like Lipitor, which is a cholesterol medication, 40 milligrams once a day, we need to know that because the plan finder needs all that detail to really make sure we're getting the most accurate pricing. We also need to know what day's supply you get. Do you get 30 at a time? Do you get a 90-day supply at a time? Sometimes those have to change depending on how the plan is, but it's important for us to know. We want to keep intact with what you're already doing if we can, and then see if there's potentially opportunities to change. And then the name of the pharmacy that you're working with. Or you're filling your prescriptions at. So whether it's a local pharmacy or a mail order pharmacy, we want to know that. We put that based on your zip code that we enter into the plan finder, it will come up with the local pharmacies. So chances are yours is right there and we can compare. Because with the Part D plans, which is something we didn't talk about 5 years ago, depending on where you fill your prescriptions could change how much money you're paying out of pocket. The plans have preferred pharmacies. And I could not tell you off the top of my head which plan has which preferred pharmacy, but the website helps guide me to help you give you that information. The other things that are helpful when we're choosing these plans are your Medicare card. We can do things a little bit more individually. We can save your drug list, so if you're coming back to us year after year, we don't have to spend all that time plugging in the information. And your current plan information. What I'm able to do is pull up 3 plans and compare them. So I like to compare for you the plan that you're currently in to the next plans that look the most cost effective to me. And then together we can make a decision for you. So what are the overall out-of-pocket costs? What should you expect to pay for? Your premium, right? That's the monthly fee that it costs you to be in the plan. The deductible, if there is one, and your drug co-pays at the pharmacy. That's going to be your out-of-pocket costs. We want to keep that as minimal as possible. And depending on how many medications you're taking will depend on what that overall cost looks like. So are there ways to save? Yes, I mentioned choosing generics over brands, choosing a preferred brand medication or a preferred generic. That's kind of a new term. There might be 5 generic medications on the market and a specific plan prefers 1 or 2 of them over the other, right? So those are another place for opportunities to save. So you should ask your pharmacist. You could apply for extra help through Social Security that might help you with your Part D plan. So one of the last things I'm going to mention is, I think about my father, who is the first person to say this to me. He goes, "Oh, Danielle, but I don't even take any medications. Why do I have a Part D plan?" Well, Dad, you're over 65 and you're eligible. If you do not have credible coverage, if you don't have something that is considered credible coverage through Medicare and you're eligible for Part D, if you don't choose a plan, you will be subjected to a penalty when it's time to take a plan on. And that penalty is 1% of that national base beneficiary. So 1% for every month that you were eligible and did not enroll. So I meet patients who were not, really not taking anything at 65, and then at 67 or 68, something happens and they have to be on a lot of medications, and it's a big cost, so they're like, all right, I'm ready to join Part D. I have to be the unfortunate person to tell them that they are somewhere around $15 extra every month on their premium because they didn't join when they were initially eligible. I know that sounds very confusing, so the takeaway point that I want you to have is that if you think you're eligible and you don't have a Part D plan now, it's time to start talking about it. If you're not sure if you're eligible, you're not sure if you have credible coverage, you should be having a conversation. Because you don't want to take any more months with not being on Part D if eventually you might need it in the future. Because it does really offer seniors cost savings. And I hate to end on like not the happiest note, but that was really kind of where my part kind of ended. So thank you for having me. I'm going to pass the mic along, and I know are we taking questions now or after? Okay, we're going to take questions at the end. So write your question down. Okay, thank you.
Thank you, Danielle. Our next speaker is Barry Cooper. Barry?
Your slides?
Good morning. I'm so glad we have Danielle here, who's a pharmacist, because I've got a burning question. Why are those bottles so hard to open? Especially if you have medication for arthritis and you can't open the bottle. All right. I want to talk a little about some of the Medicare updates for next year. You heard a few, but I want to go into a little more detail and go over some other information. I hope everybody got their Medicare card last year, the new one, without the Social Security number on it. Good. Put it aside and only use it when you are going to your doctor or healthcare provider. So many people lose them or have their number taken. And then you see all of these Medicare summary notices coming in for fraudulent claims or claims that are abusive. So you want to make sure you do not walk around with that. I mean, if you want to, write the last 4 digits down, but any healthcare provider that you see you'll give them the card, and after that, they don't need it again. If they ask you for your Social Security number, you do not have to provide that. Right? That is information that they used to ask you so you could get your Medicare number. Since the Medicare number's not on the Social Security number's not on the card, put it aside, only use it for Social Security purposes. So we want to prevent that kind of fraud and abuse because it is rampant. All kinds of scams are going out, and the numbers are staggering. $66 billion was spent last year on fraud and abuse. That's $1,000 for each person in this room. So you want to make sure you protect your card. In addition to the money, let's say you get a Medicare summary notice for a walker or a wheelchair that you didn't get, your doctor never prescribed. 2 years come by, and if you didn't report that, if you need that equipment, Medicare will not pay for it again. They already paid for it once. That stuff's supposed to last 5 years or longer. Medicare's not going to pay again. So read your Medicare summary notice. If you see something you didn't order or your doctor did not order, please call the number on the Medicare summary notice, that 800 number, and they can take your information and have it reviewed. And a lot of times it's human error, sometimes it's fraud. So I just want to get that out of the way. But please, read your mail. If it's a Medicare summary notice, read it. If it is a letter from your existing coverage, the company that covers you, either your Medigap or your Medicare Advantage, please read that, because it could be the notice of update for changes for next year. Right? So you want to make sure that the coverage you have will still work for you next year. So you have to read that. If you get something from Medicare, it'll have the CMS logo on here from the Department of Health and Human Services. You want to read that because it could be additional information about your Medicare premiums, or sometimes they'll send a letter out, benefit increase, something like that. So you want to read that, and also you want to read something that comes from Social Security, because that could also be a change in your monthly benefit. So you want to read those things. Right? I know they say they're here from the government and they're here to help you. That material is important. So you want to look at that. The other stuff you're getting, all right, all that mail, all that TV ads, most of that is marketing. You can read it or not. If you think there may be a plan that might work better for you, take a look at it. But what's really critical is you read the mail from your existing insurer. So, I want to make sure we get that. Read your mail. A lot of the other stuff, I mean, I get mail every day from these people. You wouldn't think so because I don't look my age, but or act it. But you really want to. I get so much mail. All I could say is that if Osama bin Laden was in this country, AARP would have found him. Okay? So you want to, they're going to find you anyway. Now, there are different changes to the plans. There's the HMOs, the PPOs. If you live on a farm, you have the EIOs. So and of course Medigap. Now the HMOs and PPOs can change their benefits from year to year. They have to negotiate that with the Centers for Medicare and Medicaid Services, the agency that runs Medicare. So you want to make sure that your plan will still work for you next year. They could have changes in the network, changes in their premium, changes in their formularies, which are approved list of drugs, new benefits, like you heard from Sherry. The traditional Medicare plan is not offering a lot of those benefits, but Congress authorized last year for the Medicare Advantage plans to enhance their benefits. Many of them offered vision, dental, and hearing benefits as part of their policy, but now you can have fitness, you can have medical transportation, and there's a whole litany of new benefits. And if you go to my table outside, the FCA HICAP table, you can look at all of the various benefits. Silver sneakers or exercise programs, there are nutritional programs. So if you look at that list, it'll tell you which plans offer those enhanced benefits. So you really want to be an informed consumer and advocate for yourself. So you want to double check all of that. Right? So you have the HMOs, which are closed network plans where you need a referral to see a specialist. If you go out of the network, you will pay the entire amount. Medicare won't cover that, and the plan won't, because you went out of the network, especially without authorization. So you want to double check that. Right? They offer prescription coverage and these other benefits. So there are pros and cons of all of these plans. I will not endorse any type of plan or any company, but we will help you find a plan that works best for you. There are the PPOs. These are preferred provider organizations. They're a hybrid between traditional Medicare and the HMOs. There's a network, but if you go out of the network, you still have some coverage. You pay a higher copay. They offer drugs, at least most of them do, and you do not need a referral to see a specialist. Premiums are low, just like they are with the HMOs, so you can choose what works for your pocketbook and your healthcare needs. All right, so there are pros and cons. Call us, we will help you figure it out. There are Medigap plans. Medigap plans are easy in some respects. The benefits are standard. So if you want a high-end plan, like a G plan, if you're on Medicare, you can buy the F plan. But if you want something that's a moderately priced plan, relatively speaking, you can go to an N plan, where the premiums are lower. The advantage there's a few advantages here too. Higher premiums, but there's no network. Any doctor in the country that takes Medicare, Medigap will pay. So Medicare will pay its portion, the claim is automatically crossed over, and the Medigap will pay their portion depending on the plan you buy. So there are a number of different options. You can come, and I have the sheets on my table with the different Medigap plans. One of the good things about it, though, is that let's say you want to go with one of the higher-end plans, like a Plan G. No matter who sells Plan G, the benefits are identical. So then you can look at the cost and say, all right, which is a better deal for me for that package of benefits? And that's your Medigap. You can go to any doctor in the country, like I say. So you don't have to compare with the Medicare Advantage, well, which one offers which benefits, which one has this cost, is my doctor in the network? So, I mean, they work for a lot of people. Almost a third of all people on Medicare are in one form of Medicare Advantage or another. But other folks choose other ways of doing it. If you have a retirement plan from your employer, you can disregard everything I'm saying, by the way. Right? Because that is gold, you want to keep that. They usually cover drugs, and a lot of times your employer will pay all or part of the premium. So those are great. If you're lucky enough to have worked for a large company or a union or a government agency where you can get those benefits. Okay? So that's really something important. We don't have all of the rates for 2020 for the Medigap. We have for the Medicare Advantage, and again, there are, I think, 30-something plans in New York. Come over, we will go over each plan, whichever type of plan you want. You can figure that out. We can help you with your Part D also. HICAP is all health insurance, so we can help you with your Part D, which was discussed earlier, or your Part C, which is Medicare Advantage. There's so many different nomenclatures. Part C, Medicare Advantage is one and the same. Or your traditional Medicare A and B, and your any other way you have to supplement that. So we can help with that. A couple of other things I do want to mention, and we were talking about prescriptions. There is another way to help save money with your Medicare Part D plan, and that is called EPIC. I'm sure you're familiar with that. EPIC is Elderly Pharmaceutical Insurance Coverage. It's a New York State program for New York residents 65 and older. So you can apply for that. If you're an individual with income under $75,000, you can be eligible for that program. I have the forms and the brochures on my desk. As you would expect, I have forms and brochures for everything. For a couple, it's $100,000. There's the premium plan, which goes into effect immediately, and the deductible plan, which starts to wrap around your drug coverage after you've met your EPIC deductible, which is income-based. It's on a sliding scale. So those are another good way of getting your prescription costs reduced. I know Danielle mentioned the Extra Help program, which is a Social Security program, which will give you a zero premium on most of your plans, as long as it's a benchmark plan or below. So that's another good way to help with your drug costs. Plus your co-payments are reduced drastically. And there's one other program I want to mention, which is not similar, but you can get one by getting the other, which is the Medicare Savings Program, which is a program which will help pay your Medicare premium, the $135.50 that's taken out of your Social Security check. The Medicare Savings Program will cover that. And if you are in the Medicare Savings Program, you will also automatically be eligible for that extra help, the LIS, the Low Income Subsidy. A friendlier term is extra help. So there are a number of different programs that can help you lower your prescription costs, lower your health care costs dramatically. Again, come out to my table. We can work with you on getting you applications for these programs or to help you fill them out. So see us later. I got nothing else. Thank you.
But this one, we're going to turn it over to you guys. So who has any questions from the audience?
It says I haven't heard anything about the dental. The dental of the, okay. You haven't explained about the dental on the Medicare.
Okay, well, like I said earlier, vision, dental, hearing is one of the benefits that has been part of the Medicare Advantage package for many years. Many of them still offer that, or some do as an extra rider where you can pay a little extra for that coverage. So you can get dental because traditional Medicare doesn't cover most dental work. Under most circumstances, Medicare does not cover travel out of the United States. There are a couple of exceptions. If you live in a border town, Mexico and the United States or Canada, and the nearest emergency facility is closer there, they'll cover it. Or if you're traveling from the United States to Alaska on the shortest straight highway, they will cover that. What I would suggest if you are going to travel, you might want to look at a Medigap plan or a supplement or a Medicare Advantage that has a travel benefit. Some Medigaps do, some Medicare Advantage does. All right, but traditional Medicare cannot, it's in the statute, cover you out of the United States.
If you're covered by your spousal's insurance, so in this example, if you have Emblem Health or whatever the coverage you currently have, the question you need to ask of that coverage is, are they credible coverage? Is this equal to Part D? Because if the answer is yes, you do not need Part D. You should continue with that, and only if you lose that would be when you need to get Part D.
And then is there a penalty?
No, there would not be a penalty. If you had credible coverage for 10 years, so from 65 to 75, if you had credible coverage, and then at 75 you become eligible for a Part D, there is no penalty. It's only if you did not have a credible coverage. So that might be the question you might have to ask. Is what I have now credible coverage? Good.
I have one question for Sherry. First of all, we love medical physical therapy. We love that. The other thing, the question is, Ashley. Do you provide through Ashley?
Yes, Ashland provides active and sober fit, so we are certified to do that as well. So we have 11 outpatient facilities, and we provide all these programs in different senior centers and some of the senior living.
Medicare Advantage is a form of getting your health care. If you sign up for Medicare Advantage, you have to live within the plan rules. AARP, or United Healthcare, is a company. They offer many different products. They offer Medigap. AARP offers prescription coverage. They have, United Healthcare has Medicare Advantage. AARP, or United Healthcare, is a company offering many different products. Medicare Advantage is a form or a way of getting your health care. Okay? Medigap works with traditional Medicare and a prescription plan, another way to get your health care. If you have a retiree benefit, keep that, because that is usually similar to a Medigap with drug coverage. All right? So that other portion did not really apply to cases like yours where there's a retirement benefit which covered your prescriptions, creditable coverage like was mentioned, and your supplemental, which covers your deductibles, co-insurance, things, the gaps, or your cost sharing for Medicare.